Thank you for the introduction and the invitation to this so interesting session. I'm going to present you the differential effects of heat-not-burn and conventional cigarettes on coronary flow, myocardial and vascular function. Smoking constitutes a major modifiable risk factor for cardiovascular disease. Compounds of cigarette smoke enhance sympathetic stimulation, which causes a mismatch of myocardial oxygen supply and demand, decrease directly oxygen availability, produce oxidant gases, which in turn activate the coagulation cascade and also promote inflammation. All these effects are implicated in atherogenic processes. More than 5,600 chemical components have been identified in traditional cigarettes, many of which exert harmful effects on the cardiovascular system. Thus, the development of potential reduced exposure products, PrEPs, with reduced biomarkers of exposure levels, neither oxidative stress burden nor markers of inflammation were improved. Heat-not-burn cigarettes has been developed as a new generation non-combustible PrEP. Early evidence of HNBC's heat-not-burn cigarette studies is promising concerning the biomarkers of exposure level. The aim of this study was to investigate the effects of heat-not-burn cigarettes on endothelial function, arterial stiffness, myocardial deformation, oxidative stress, platelet activation, both in acute context and after 1 month of switching to heat-not-burn cigarette smoking in comparison with traditional tobacco cigarettes. For this reason, 50 current smokers and 25 controlled smokers from the Attikon University Hospital Smoking Cessation Unit were included in our study. Smoking status was verified by way of self-reported smoking burden per day and exhaled carbon monoxide concentration measurements. Exclusion criteria included history of cardiovascular disease, hypertension, uncontrolled diabetes mellitus, dyslipidemia, hepatic or renal failure, active neoplasia, alcohol abuse, pregnancy, and psychiatric illness as well. Our study included an acute and a chronic phase. The acute phase of the study entailed an initial smoking session of inhaling on a non-lighted cigarette for several minutes, simulating the mean duration of a traditional cigarette smoking. The participants were thereafter randomized into either a tobacco cigarette smoking session using a single mainstream T-cig or a single heat stick puffing session using a commercially available heat-not-burn cigarette. After a washout period of 60 minutes, the subjects were crossed over to the alternative session, conventional cigarette or heat-not-burn cigarette, respectively. The decision about the washout period duration was based on evidence that the acute effects of smoking on arterial function resolve within 60 minutes. For the chronic phase, all participants were instructed to replace the conventional cigarette smoking with heat-not-burn cigarette puffing for 1 month. 25 conventional cigarette smokers served as control subjects for the chronic phase of our study. We measured first carotid femoral pulse wave velocity by complier device, which is the gold standard method to assess arterial stiffness non-invasively. Second, plasma levels of malondialdehyde and protein carbonyls in order to estimate oxidative stress burden. Third, thromboxane B2 as a marker of platelet activation. Fourth, flow-mediated dilation to to assess endothelial function. Fifth, coronary flow reserve by transthoracic Doppler echocardiography. Sixth, myocardial work, which is derived by the left ventricular pressure strain loops. And finally, the concentration of exhaled carbon monoxide. Arterial elasticity, oxidative stress, platelet activation, and exhaled carbon monoxide were assessed at baseline after each smoking session of the acute phase and at the chronic phase as well. Endothelial function, coronary flow reserve, and myocardial deformation were evaluated at baseline and after 1 month in the chronic study. The two groups did not differ significantly as far as age, sex, systolic blood pressure, diastolic blood pressure, heart rate, BMI, baseline carbon monoxide, and PAC years are concerned. Furthermore, all subjects had similar baseline characteristics in terms of arterial stiffness, myocardial deformation, oxidative stress, and platelet activation status. After 1 month of heat-not-burn cigarette puffing, the participant showed a great decrease of exhaled carbon monoxide in contrary with the control group. Also, the plasma levels of MDA, protein carbonyls, and thromboxane B2 dropped remarkably in the HNBC group, whereas remained approximately steady in the control group. More notably, in the acute phase of our study, conventional cigarette smoking resulted in greater increase of pulse wave velocity than heat-not-burn cigarette puffing compared to baseline. In parallel, we noticed that T-cig smoking caused a significant rise of systolic blood pressure compared to baseline, while this finding was not so evident in the HNBC group. As for the MDA plasma levels in the acute phase of our study, conventional cigarette caused a steep increase of MDA levels in contrast with a lack of increase after heat-not-burn cigarette puffing. Thromboxane B2 levels fluctuated at the same level after conventional cigarette smoking, whereas decreased significantly following HNBC puffing. In the chronic phase of our study, coronary flow reserve elevated greatly in the heat-not-burn cigarette group while remained almost steady in the conventional cigarette group. Similarly, flow-mediated dilation improved significantly in the HNBC group. Compared to baseline, no significant changes were observed in all vascular markers in the control group. Additionally, global wasted work was reduced at 1 month of heat-not-burn cigarette puffing, which is interpreted as improved work efficiency. In conclusion, acute heat-not-burn cigarette puffing did not cause a further impairment of arterial elasticity or augmentation of oxidative stress burden, platelet activation, and exposure to carbon monoxide compared to baseline, in contrast to acute smoking of tobacco cigarettes. Switching from tobacco cigarettes to heat-not-burn cigarette for 1 month resulted in improved endothelial function, oxidative stress burden, as well as reduction of platelet activity and exposure to carbon monoxide, while causing an improvement in coronary flow reserve and myocardial work efficiency compared with tobacco smoking. Thank you for your attention.